Hi guys, myself Yashashvi. In today's video, we are going to discuss about lysosomal storage disorders. The first question that arises in our mind is, what are lysosomes? What do they do? Lysosomes are cell organelles that has three main functions that include cell membrane repair, phagocytosis, and breakdown of macromolecules like mucopolysaccharides, sphingolipids, glycolipids, and proteins by the enzymes present in them. Due to deficiency of these enzymes, it leads to lysosomal storage disorders. These are inborn errors of metabolism. Lysosomal storage disorders are caused due to accumulation of abnormal metabolic products due to enzyme deficiencies. These disorders are of two types. They are sphingolipidosis, mucopolysaccharidosis. Coming to sphingolipidosis, the basic component of sphingolipids are ceramides. This ceramide is formed by an amino acid serine when combined with two fatty acids. When this ceramide is combined with phosphatidylcholine, it forms sphingomyelin, which is degraded by an enzyme known as sphingomyelinase. Due to deficiency of this enzyme, it leads to Niemann-Pick's disease. Findings are progressive neurodegeneration and hepatosplenomegaly due to accumulation of sphingomyelin. And we also see a cherry red spot in macula, which is seen here. It is due to accumulation of lipids in ganglion cell layer excluding fovea, which appears as cherry red spot on macula in fundoscopic examination. We also see a foam cell, which is seen here on histopathological examination, which is lipid-laden macrophages, that is, macrophage filled with sphingomyelin. Mnemonic to remember Niemann-Pick's disease is Niemann-Pick is nose with big finger. Here finger is written as finger. Niemann-Pick refers to Niemann-Pick. Big stands for hepatosplenomegaly and Sphingor for sphingomyelin. Coming to next disease. When ceramide combines with glucose, it forms glucocerebroside, which is degraded by an enzyme known as glucocerebrosidase. Due to deficiency of this enzyme, it leads to formation of Gaucher's disease. Some common clinical findings seen here are hepatosplenomegaly and pancytopenia is due to accumulation of glucocerebroside in liver and bone marrow respectively. Due to accumulation of glucocerebroside in bones causes osteoporosis, avascular necrosis of femur, and bone crisis. Histological findings show Gaucher cells which resembles crumpled tissue paper seen here, which are macrophages filled with glucocerebrosides. This picture here shows the symptoms of Gaucher's disease. It is hepatosplenomegaly, anemia, thrombocytopenia due to bone marrow infiltration, and bone pains. Simply we remember Gaucher's disease for G, that is Gaucher's for glucose. Glucose means glucocerebroside, glucocerebrosidase. Coming to next disease, when ceramide is combined with galactose, it forms galactocerebroside, which is degraded by enzyme galactocerebrosidase. Deficiency of this enzyme leads to Krabs disease. Clinical findings seen in these conditions are peripheral neuropathy and optic nerve atrophy due to destruction of oligodendrocytes, which are myelin-forming cells due to accumulation of galactocerebroside and psychosin in them. Histological findings show globule cells, which are multinucleated macrophages containing undigested galactocerebrosides. So, Krabs disease is also known as globule cell leukodystrophy. Some mnemonic to remember Krabs disease is crab eyes are globe shaped, which are not exactly, but here crabs refers to Krabs disease. Eyes show optic nerve atrophy and globe show globule cells disease. Due to deficiency of enzyme hexosaminidase A, GM2 ganglioside buildups leading to development of Tay-Sachs disease. Some common symptoms of Tay-Sachs disease are progressive neurodegeneration, developmental delay, and hyperreflexia, which occurs due to progressive damage to nerve cells in central nervous system due to accumulation of GM2 ganglioside. Hyperacusis is also seen here, which refers to heightened sensitivity to sound. The specific mechanism leading to hyperacusis in Tay-Sachs disease is not fully understood, but it is believed that damage to nerve cells involved in processing sound result in abnormal perceptions of sounds. Due to accumulation of lipid in ganglion cell layer, we see cherry red spot on macula in fundoscopic examination, same as in Niemann-Pick's disease. But the main difference between Tay-Sachs and Niemann-Pick's disease is seen in abdominal examination, where we see hepatosplenomegaly in Niemann-Pick's, but no hepatomegaly is seen in Tay-Sachs disease. Cherry red spot is seen in both diseases, but hepatosplenomegaly is only differentiating character. On histopathological examination, we see lysosome with onion skin appearance. As seen here, GM2 ganglioside is a complex molecule which accumulates in concentric layers in lysosomes, which are called zebra bodies. Presence of zebra bodies is a hallmark sign of Tay-Sachs disease. A small mnemonic to remember Tay-Sachs disease is a gang of 6 Jews. Here, gang stands for GM2 ganglioside, 6 stands for hexosaminase A enzyme. Jews means it is most commonly seen in Ashkenazi Jews. To next disease, when ceramide combines with glucose, galactose, and galactose, resulting in compound ceramide trihexoside, referring three hexagonal ring structures. This compound is normally broken down by the enzyme alpha galactosidase A. However, in case of Fabry's disease, this enzyme deficiency leads to accumulation of ceramide trihexoside. Some common clinical findings seen in this disease are divided into early and late stages. In early stage, there is a triad which shows peripheral neuropathy, angiokeratomas, and hypohidrosis. Coming to peripheral neuropathy, it shows burning sensations in palms and soles. Angiokeratomas are small red to purple bumps usually appear in leg and groin areas. These are due to dilatation of blood vessels near skin surface combined with overgrowth of skin cells that are keratinocytes. Hypohidrosis is due to accumulation of ceramide trihexoside in sweat glands. Late manifestations include progressive renal failure and cardiovascular disease. Fabry disease is one and only X-linked recessive disorder in spondylolisthesis, remaining are autosomal recessive. Mnemonic to remember Fabry's disease is Fabry's for Fabry's. C here as is replaced by C. F stands for fails to set, that is hypohidrosis. A stands for angiokeratoma and alpha galactosidase A deficiency. P stands for burning pain in hands. R refers to renal failure, and Y means YX genotype, that is X-linked inheritance. C for cerebral trihexoside and cardiovascular disease. Due to deficiency of enzyme aryl sulfatase A, cerebroside sulfate is accumulated and due to development of disease metachromatic leukodystrophy. The clinical findings seen in this disease are central and peripheral demyelination with ataxia and dementia. It is also autosomal recessive inheritance. Mnemonic to remember metachromatic leukodystrophy is AML, that is A for aryl sulfatase A, ML for metachromatic leukodystrophy. Coming to mucopolysaccharidosis, it has two syndromes. They are Hurler syndrome and Hunter syndrome. It is due to accumulation of glycosaminoglycans like heparan sulfate and dermatan sulfate. Coming to Hurler syndrome, it is due to deficiency of enzyme alpha-L iduronidase. It causes accumulation of heparan sulfate and dermatan sulfate. It is autosomal recessive in inheritance. Some clinical findings in Hurler syndrome are developmental delay, hirsutism, clouded cornea, hepatosplenomegaly, airway obstruction. Coming to Hunter syndrome, it is due to deficiency of enzyme iduronate 2 sulfatase, which causes accumulation of heparan sulfate and dermatan sulfate. It is also an X-linked recessive disorder like Fabry's disease. Hunter syndrome show mild symptoms of Hurler with aggressive behavior. The main difference here is there is no corneal clouding in Hunter syndrome. This is corneal clouding we see here. This is the picture showing the symptoms of Hurler syndrome. There are frontal bossing, short neck, depressed nasal bridge, corneal clouding, intellectual disability. Mnemonic to remember Hunter syndrome is: a aggressive hunter has clear shot X. I would run to safety. Here, aggressive stands for aggressive behavior. Hunter stands for Hunter syndrome. Has clear shot means it has clear cornea. X refers to X aggressive disorder. I would run to, it refers to iduronate 2, which is the enzyme iduronate 2. Safety stands for sulfatase, which is the enzyme iduronate 2 sulfatase. Let's summarize this topic by this picture. Here, number one is GM2 ganglioside is broken down by the enzyme hexosaminidase, which deficiency leads to Tay-Sachs disease. Coming to number two, ceramide triaxoside is broken down by enzyme alpha galactosidase, which deficiency leads to Fabry's disease. Coming to number three, sulfate group is broken down from galactocerebroside by enzyme aryl sulfatase, which is deficient in metachromatic leukodystrophy. Coming to number four, galactocerebroside is broken down by enzyme galactocerebrosidase. It is also known as galactosyl ceramidase. It is deficient in Krabs disease. Coming to number five, glucocerebroside is broken down by glucocerebrosidase, also known as beta glucosidase. It is deficient in Gaucher's disease. Number six, sphingomyelin is broken down by enzyme sphingomyelinase, which is deficient in Niemann-Pick's disease. All are autosomal recessive disorders except Fabry's, which is X-linked recessive disorder. All these diseases are treated by recombinant enzymes. Thank you. Please like, share, and subscribe.